Hey guys, welcome back. Danielle again with Pure Root Wellness, and we're going to continue off of the general minerals podcast. We had originally talked about the macro minerals, and now we're going to kind of delve into the trace minerals. And trace minerals are just that, trace amounts of minerals. You don't need an excessive amount of these minerals to function. These are itty bitty little amounts, but very important minerals to help with certain properties and functionality of the body. So the first trace mineral we'll talk about is iron. Iron is a production of hemoglobin and oxygenation of red blood cells. Iron does help growth and immune properties, or it does have growth and immune properties, and is stored in the blood basically as an iron lab value. The hemoglobin value is actually used kind of as a screening for whether you may be iron deficient or anemic in that essence, or iron deficiency anemia, I should say. But the iron itself is stored in the liver, stored in the spleen, bone, muscle. Ferritin is a lab value, really the most efficient test for diagnosing iron deficiency anemia, because this will be low, really in the first stage of iron depletion, anything less than 30 micrograms per liter. So really looking at the ferritin lab value will kind of help to say, your hemoglobin is low, but your iron, your ferritin is also low as well. And really kind of dipping into the first stage of showing that you're iron deficient. Transferrin, also an important test that we look at. It's the protein in the blood that actually helps bind the iron and transports it. So that's something else that we kind of look at as well. Is this maybe a binding issue, a transportation issue? What kind of holistically is going on in the blood that would make you deficient in iron? Looking at deficiencies themselves, with lack of iron, you can actually have insufficient intake of iron. You could be bleeding. Diets high in phosphorus will actually deplete your iron stores. Chronic illness such as like kidney disease, we see a lot of patients come in with low iron levels, and it typically is a depiction of their chronic illness that they've been battling for a while. Prolonged use of antacids, it actually binds to the iron in your stomach and depletes it quickly. So if you're someone who has pretty chronic gastric reflux or GERD, heartburn kind of issues, and you're eating Tums like Skittles, there's a good chance that your iron could definitely be very low, and something to kind of take into consideration. Excessive coffee and tea intake. Again, looking at that caffeine and creating poor absorption and things of that nature can cause some issues. Lack of B6 and B12 can also have some issues with iron deficiency, and it's not uncommon in vegetarians, vegans to see a pretty low iron in general. And symptoms you'll start to look for in someone who is iron deficient is brittle hair, brittle bones, nails, almost spoon-shaped kind of nails, fatigue. They can be very peaked or pale. Sometimes we have difficulty swallowing, digestive issues. Very rarely will we have excess iron, a buildup of iron. The hemochromatosis that we can see, that's actually excess of iron. Like I said, patients kind of appear with this more bronze skin coloration as well. Adults, we're looking at about 8 milligrams in a male, 18 milligrams in a female per day. Kind of makes sense, right? Males don't have a menses, females do. So we tend to obviously lose more iron than our counterpart. And then really the best form of iron to ingest would be like a ferrous gluconate or a fumarate. Kind of looking at the bioavailability, really those two isomers, or those kind of forms of the iron itself, are just better absorbed and tolerated. And really, unless you're diagnosed with anemia, menstruating, or of childbearing age, you really don't need to take an iron supplement. Iron can cause a lot of other issues as far as constipation. Sometimes it can make it look like you're having, dark, bloody bowel movements, just because of the way the iron changes kind of the quality of the stool itself, and that can lead to kind of some false pre-notions of I have a GI bleed. So typically, if you're eating a fairly healthy diet, and getting some of the ingredients that pictures that I've put up there, your iron is probably going to be pretty close to up to par, unless, like I said, looking at vegetarians, vegans may need some form of kind of supplement down the pipeline at some point in time. And then there are two forms of what we call kind of heme. The heme is kind of the binding part of the red blood cell itself. The heme you get from meats, and the non-heme you can get from plants and iron fortified foods. Heme form has better bioavailability, but spinach has a lot of iron itself, but poor bioavailability because of the polyphenols, which actually inhibit the iron absorption. So, if you're ingesting a lot of spinach and things of that nature, make sure that you're also getting different aspects of iron from different foods if you are a herbivore instead of a carnivore. It's also important to note serum ferritin. So, we were talking about ferritin being that lab value that's kind of important in deciding really the first stage of iron depletion. Serum ferritin can actually be elevated during periods of like an inflammatory process or infection. So false negatives of iron deficiency anemia you need to be aware of that. We were kind of finding this out with COVID. Ferritin was one of the lab values that we were looking at that was profoundly elevated in a lot of our patients. And, we were trying to find maybe some type of correlation with that. But obviously, during the COVID process, you have a pretty significant inflammatory issue going on, or infective process going on. So we couldn't really hang our hat that ferritin was a level that could tip us off on whether a patient was actually COVID positive or not when we were first kind of seeing all that. But anyway, too much iron intake can actually lead to the production of free radicals and lack of vitamin E. So again, maybe another reason why you don't really need a lot of iron supplementation unless we really know that you are iron deficient and have some form of iron deficiency anemia. Zinc. Zinc is a big one. It's required for making proteins. It helps prevent acne. It has a lot of healthy immune system properties. It enhances acuity of taste and smell, which is pretty cool to think about. And then it protects liver and bone formation. So lack of zinc, hence you can have some loss of taste and smell. Your fingernails get thin, acne, hair loss, poor night vision, poor wound healing. It's a huge component of wound healing. I know in our surgical ICU, we do incorporate a lot of zinc in our patients who have abdominal wounds and big, kind of grafting wounds that need to heal well. Zinc will decrease with diarrhea, so you'll start to get depleted if you have pretty profound diarrhea. Kidney disease, cirrhosis, diabetes, and a lot of fiber consumption. Eventually your zinc will, the fiber itself will actually cause the zinc to be excreted through the intestines. So kind of being, cognizant of that. I know excessive sweating is also another area where it can cause some zinc loss within the sweat itself. So, keeping in mind if you're someone who works out hard, has, pretty excessive sweating, zinc may be something that you may be slightly deficient in. It's very important to not take zinc with iron. They actually interfere with another's activity in the body. And then there are supplemental forms, several different forms of zinc, including zinc gluconate, zinc sulfate, zinc acetate. And the percentage of elemental zinc really varies by the form. 220 milligrams of zinc sulfate really contains about 50 milligrams of elemental zinc itself. So just be cognizant when you're saying, I'm getting about 220 milligrams of zinc in zinc sulfate, you're actually getting only about 50 milligrams of the elemental form from that instance. So typically you need about 8 to 11 milligrams every single day. You can take up to about 100 milligrams a day of zinc. More than 100 milligrams, you can start to kind of depress the immune system a little bit. So if you are going to go above 100 milligrams, you would really only want to do this for a short course, maybe a handful of days, and really not go kind of overboard. Again, this may not be one of those trace minerals, again, trace minute amounts where more is not going to give you better in this instance. So when looking at vegetarians and zinc content, vegetarians actually require as much as 50% more of the RDA for zinc than non-vegetarians. In addition, they might benefit from using certain foods, preparation techniques that reduce the binding of zinc by, increasing its bioavailability. Basically, techniques to increase zinc bioavailability include like soaking beans, grains, seeds for several hours before actually cooking them and allowing them to sit after soaking until maybe sprouts form. That's just kind of an interesting tidbit in regards to how vegetarians really don't get the good absorption of zinc just based on the lack of meat product that they're not consuming. And then zinc in the common cold. Researchers have really hypothesized that zinc could reduce the severity and duration of cold symptoms by directly inhibiting the rhinovirus binding and replicating in the nasal mucosa and suppressing the inflammation process. More recently, they looked at a Cochrane review, concluded that zinc, either lozenges or syrup, it is beneficial in reducing the duration and severity of a common cold in healthy people when taken within 24 hours on the onset of symptoms. So you got to kind of stay on top of it, but something that they are kind of looking at and the benefits of zinc in regards to kind of helping with the common cold or the rhinovirus. Now, there's still really insufficient data to recommend either for or against the use of zinc for the treatment of COVID-19. The increased intracellular zinc concentrations efficiently impair replication in a number of RNA viruses. And zinc has really been shown to enhance like cytotoxicity and induce apoptosis or cell death when used in vitro with zinc ionophores, i.e. chloroquine. I'm not going to get into that debate, but I think it's again another important area of research. When COVID first happened and we were trying to put it all together, we had thought, you've got to look at a risk versus benefit. Zinc was something that had low risk and potentiation for benefit, and we felt that giving our patients zinc may actually help in one way, shape, or another. I think more research needs to be on the topic, but just something to kind of think about, which could help at least maybe with prevention medicine, if not kind of the retrospective approach to zinc supplementation. Iodine. Our bodies cannot produce this trace element, thus we need it from the diet. It helps to metabolize excess fat. It promotes a healthy thyroid gland. Iodine deficiency or lack thereof is really rare now due to the introduction of iodine in salt products. We can all see on our little salt, little bucket, iodized salt is always on there. And the thyroid stimulating hormone is high, resulting in enlargement of the thyroid gland. This is where the goiter comes from, really. It's the thyroid gland actually becoming enlarged, and your TSH will reflect that. The body basically wants to trap more iodine. That's why this happens. That's why it becomes enlarged. And deficiency in iodine can actually show some lack of cognitive decline in children as well. And why is this important with the thyroid gland in general? The thyroid gland helps with metabolism, growth, and development, stimulates the heart rate and contraction of the heartbeats, breaks down cholesterol and triglycerides. It really has a big functional role in our metabolic processes. So if we're not giving the thyroid enough of what it needs, we start to see kind of detrimental effects to that. Adults typically only need about 150 micrograms a day. And if you do have an underactive thyroid, some foods that block the uptake of iodine should be avoided when eaten raw. So Brussels sprouts, cabbage, cauliflower, kale, peaches, pears, spinach. If you have a hypothyroid and underactive thyroid, these foods can actually block the uptake of iodine, and really eaten raw should be kind of not performed. Selenium, a pretty cool trace mineral as well. Its function is actually to inhibit oxidation of lipids or fats. It acts as a component of the enzyme glutathione peroxidase. Selenium, another awesome trace mineral. Its function is to inhibit oxidation of lipids, or i.e. fats. It acts really as a component of the enzyme glutathione peroxidase, and indirectly it will protect the immune system by stopping free radicals from forming. So pretty cool. And when you're talking about like oxidation is really just the gain of oxygen. If you cut an apple in half and leave it actually sitting out, it'll turn brown, right? Because it's losing its oxygen. If you put that apple in water or add lemon juice to that apple, the oxidation process will slow down. Glutathione peroxidase, this is the vital antioxidant when combined with vitamin E. They work synergistically to aid in the production of antibodies. So, looking at how selenium and this enzyme actually work together to inhibit this oxidation process is pretty cool in your body. It's pretty complex, but pretty interesting to say the least. Selenium also helps to regulate the thyroid hormone. It helps to convert the T4 into the active form of T3, and it's commonly found in soil, which I didn't know until kind of, delving a little more into this, that selenium is a big kind of factor found in our soil system. And really, it's been associated with reduced risk of prostate and breast cancer when you are selenium replete and have enough selenium in the system. It can help to improve the immune function as far as T helper cells and antibody production go. When you do have a deficiency in selenium, it can be linked to cancer and heart disease. You can be more prone to infections and have some liver and pancreatic impairments as well. Daily dose is about 55 micrograms. Again, it can range anywhere from 55 to 150. Greater than 200 a day, you're going to start to run into problems: hair loss, irritability, liver, kidney problems, tooth loss. This is something that I would err on the side of caution when really making sure that you're not overdoing it with selenium. I.e., you see a picture of the Brazilian nuts there. 1 ounce or 6 kernels contains about 500 micrograms of selenium. So you're literally looking at 1, maybe 2 kernels of Brazilian nuts a day, and you are good to go in regards to your selenium. Copper really helps with the formation of bone, the hemoglobin, and the red blood cells. It works alongside zinc and vitamin C to form elastin, or the skin protein and collagen that you see. Helps really with healing process, hair and skin coloring, taste sensitivity, acts as a cofactor for a lot of enzymes, and really helps with defense against oxidative agents again. The superoxidase dismutases, which can start to kind of wreak havoc. It really protects us against some of these crazy oxidative agents that cause havoc and wreak problems in our body. A deficiency in copper, you start to see anemia, baldness, weakness, skin sores, and then too much copper can actually be a problem as well. It can actually start to destroy eye tissue. You'll start to see cognitive impairments, vomiting, irritability, rashes. So another trace mineral that you really need to be paying attention to the dosage and how much you're getting, and not overdoing it. Really, the take home is just get copper from the food rather than supplements. This is kind of another one where this is how I stand, at least with like iron and copper. I tend to get a multivitamin that has neither in them, and just make sure I'm eating my garlic, my almonds, my barley, things of that nature, chickpeas, sesame seeds, tofu. All of these things will get you just what you need to make sure that your copper is not lacking. Manganese is another trace mineral. Small amounts are needed, basically for protein and fat breakdown. Promotes a healthy immune system, good blood sugar regulation, bone growth, cartilage formation. It's really important for people with iron deficiency anemia. These kind of go hand in hand together. It works well with the B complex vitamins, mainly thiamine, to give an overall feeling of well-being. So, if you're struggling with kind of some depression or, thoughts where you need kind of that umph in regards to your overall well-being, manganese and thiamine together can help with that, or at least a B complex vitamin with manganese as well. Helps with forming mother's milk as well, which is pretty cool. So again, something important for breastfeeding mamas as well. When you're looking at a deficiency in manganese, again, kind of very rare. You can start to see confusion, convulsions, poor vision, hearing, heart problems, profuse sweating, teeth grinding. Again, very rare. And this is one where we don't check a lot with these trace minerals. Again, we kind of assume that, if the body isn't showing us that it's deficient in manganese, we're not checking it very frequently. You wouldn't go to your PCP and get a slew of these trace minerals, as a blood work component. But just, again, an idea of, hey, I'm starting to develop, sweating and teeth grinding and having some heart issues. This may kind of hone in on a deficiency that's kind of underlying as well. Excuse me. So fluoride, big kind of talk on fluoride, and I come from an area in Michigan where we were the first to fluorinate our water. I have certain, passionate thoughts about this. You can see my hometown was the first city in 1945 to fluorinate the water. Supposedly, fluoride aids in the structural components of bone and teeth. It helps to prevent dental cavities by allowing tooth mineralization and inhibiting bacteria that can cause tooth decay. Fluoride is not generally considered an essential mineral element because humans really don't require it for growth or to sustain life. So that's kind of where I have a little bit of an issue with putting it through the water system. Just in regards to it not being necessarily an essential mineral element. Does it help possibly with preventing cavities? Very well could be. But so can all of the other, fluorinated products the toothpaste that we use, kind of other processes that we have in our everyday life that could give us minute amounts of fluoride and help with dental caries as well. About 1 cup of fluorinated water is about 0.2 to 0.3 milligrams, and really you're looking at about 3 to 4 milligrams a day. So you truly shouldn't be, getting an inordinate amount of fluoride throughout the day, just given, you need a certain amount of ounces of water per day. I have a typo there. 1 cup of black tea has about 0.2 to 0.5. So, you're getting it from other areas as well in regards to fluorination in certain products. And really the debate is how much is too much, bottled water versus home filtration system. I do have a whole podcast on healthy water and kind of looking more into this as well. But like I said, your toothpaste has, fluoride containing toothpastes demonstrate really that dental caries, the prevalence of dental caries was about 40 to 60% lower in communities, and truly approximately 74% of the U.S. population receives water with sufficient fluoride for prevention of dental caries. That's awesome. But again, I guess looking at this, the research shows, they did show a meta-analysis out of China. They found lower IQ in children exposed to fluoride concentrations ranging from 1.8 micrograms per liter to 11.5 micrograms per liter of drinking water. And really, the concerning limitations to how the studies were conducted with inconsistencies. New Zealand actually conducted another 40-year study showing really no association between fluoride exposure and measured IQ. But there are other research articles out there that, say that fluoride can be problematic, specifically in boy toddlers, and IQ concerns. So something that, I urge you to kind of look into yourself. But I kind of stand in a certain direction. And like I said, it's kind of wild given that the city that I grew up in was really the first in the US to do this. But I don't really know how necessary it was if it was truly just for cavity prevention. Again, I know good teeth health trickles down to good heart health and all those things. I'm not denying that at all. I just think we really need to look at the data and make sure that we're doing this right and not having any issues that can come about. Chromium, another trace mineral involved in the metabolism of glucose, which is like body sugar molecules, and helps to produce energy. It really stabilizes insulin utilization. So for diabetics, this is very important, chromium itself. Deficiency, you're looking at, an average American diet lacks chromium. It's not really easily absorbed from our foods. It's not in our foods. It's really lost during a lot of the processing, impact. And sugar can actually cause loss of chromium. So, and interestingly enough too, athletes may need a higher amount, or people who consume higher carbohydrates. You may need some more chromium as well. Insulin-dependent diabetics, you should not use chromium unless you talk to your PCP. It can actually make the insulin more effective, causing a hypoglycemic event. So if you're going to start incorporating this trace mineral into your diet and you are an insulin-dependent diabetic, meaning i.e. you use insulin, not oral, but insulin, you should really talk to your doc first before you kind of go buck wild on incorporating more chromium in your diet. Deficiencies also, indications for coronary artery disease. Baby takes a lot of chromium during pregnancy. We talked about glucose intolerance, and then anxiety, fatigue can be an issue if you're lacking chromium. You need about 25 to 35 micrograms a day. Chromium picolinate is the best form. It's chelated with natural occurring amino acid metabolites. And for those non-meat eaters like myself, the brewer's yeast, it's used in the production of beer and bread. It's made from a Saccharomyces little bug, a one-celled fungus, I should say. It's energy producing. What's interesting was, the movie, Erin Brockovich, those individuals were actually getting sick from the hexavalent form, or the byproduct of metal, which was chromium. The trivalent form is actually the dietary form, and it's safe. The hexavalent form is not safe. So just a little tidbit of nugget of knowledge there as well. And really the research suggests that the proportion of chromium absorbed from chromium picolinate is about 1.2%, though a healthy diet on average, you're getting about 29 to 65 micrograms a day. So if you're eating a healthy diet, you probably don't need this trace mineral to, get you where you need to get. So molybdenum is a trace mineral that I truly am just starting to learn more and more about. It's really only needed in extremely small amounts. Has a nitrogen metabolism. It really it helps to convert purines to uric acid, and excess of this can really result in profound gout. So kind of understanding how that process goes, the dreaded uric acid with gout, you really need to make sure that you're not overdoing it if you're someone who is prone to gouty flare-ups. But it does help to support bone growth and strengthens teeth. Very rare to have a deficiency in, but it can show up as like mouth and gum disorders, potential for cancer, and impotence in older men. And really you're looking at 15 milligrams a day. Don't take more than that. Like I said, you're going to start kind of running into the risk of, gouty flare-ups and kind of issues with that. And then lastly, boron. Boron really helps to promote healthy bones, muscle growth, assists in production of your natural steroid compounds. You really need boron for metabolism of calcium, phosphorus, and magnesium. So boron is very important. just kind of piggybacking off of all of those other kind of, macro minerals that you need. Helps with brain function, promotes alertness, utilizes energy from fats and sugars, a very important, trace mineral and factor in optimal functionality. Deficiency, really the elderly population is where we kind of see this a lot. The deficiency itself will deplete vitamin D stores, and you're really only looking at like 2 to 3 milligrams per day. So, all of these healthy foods that you can see kind of pictures of, grab them, eat them, and 9 times out of 10, you're going to be just fine with the, boron consistency in your system. There is a little bit of research saying that boron might help to shrink prostate tumor size. Again, a lot more research, needing to look into this, but just something to kind of, put in your back pocket. Helps to maybe alleviate joint discomfort, preserves cognitive function, and really promotes kind of less calcium loss, which would benefit our postmenopausal osteoporosis females as well. So, and again, not taking more than 3 to 6 grams of boron per day. High doses really start to begin to be toxic. Working with your PCP, your naturopathic doctor, your functional medicine doctor, whomever you trust that has educated themselves in, making sure that you're getting the right amount of trace minerals, minute amounts, if you're not thinking that you're able to get them from your diet alone. And that concludes the rest of the trace minerals. A little bit of longer podcast, but I think super important to just get a good foundation of the macro and trace minerals that help us exist as human beings and promote really optimal functionality to be the best selves that we can be. If you have any comments, questions, concerns, suggestions, something else you want me to look up and kind of talk about in another podcast, go ahead and shoot some comments below. If not, I hope you all are well and be well. Talk to you guys soon.